Words matter. The negative impact of Elderspeak. Written by Waqar Ahmad, Ph.D., Leadership Diversity Fellowship, Leading Age, and A.G. Rhodes. When organizations are changing their cultures and working toward implementing and integrating person-centered care and practices, how we speak matters. Words matter. It is vital that we understand Elderspeak and how it relates to quality of life and communication in long-term care settings. Because staff often juggle several tasks at the same time, they may not realize how the way they speak affects residents. However, staff can interact with residents in a controlling way that assumes the residents are incompetent and totally dependent on them, when in reality, they are not. This form of communication is called Elderspeak. Elderspeak usually involves the use of inappropriate, condescending, or childlike speech with residents. Some staff may even think of Elderspeak as a meaningful way to accommodate residents' needs. They may feel they are showing kindness or being empathetic, but it is critically important to realize that the harm done by Elderspeak is far greater than the benefits. Elderspeak can be confused with comfort talk, which is mostly used in healthcare settings. Comfort talk is an engagement technique that reduces patients' stress, pain, and anxiety. It involves techniques of quickly building a comforting relationship and using calming, hypnotic language. This is often used by staff before a patient is about to have surgery in the hospital, for example. Contrary to comfort talk, Elderspeak has several regularly documented negative effects on residents. Staff should be aware that Elderspeak may undermine the psychological, physical, and mental well-being of residents in the following ways. Elderspeak can increase resistiveness to care. Residents are found to be more resistive to care when staff members use a childlike communication style with them. Residents may resist in various ways, such as resistance to medication, exercise, and physical therapy, or being less cooperative with staff in negotiating activities of daily living. Resistiveness to care in response to Elderspeak is more widespread among residents living with dementia. Elderspeak can cause psychological issues. Elderspeak can trigger depression and aggressive verbal behavior among residents. The use of patronizing speech with residents reduces their confidence and makes them feel less valuable. As a result, they may feel more depressed and engage in aggressive verbal behavior such as yelling, screaming, and loud speaking. Elderspeak can intensify the loss of independence. Using baby talk with residents negatively influences their independence by making them feel less competent. When residents are spoken to in a patronizing way, it weakens their confidence and discourages them from asserting their independence. This further makes them more reliant on others for assistance with tasks they can do for themselves. Elderspeak can harm dignity. Elderspeak harms the dignity of residents because the notion behind baby talk is that residents are less capable or intelligent than they truly are. This type of communication gives them the message of incompetence and reduces their sense of self-worth. Elderspeak can erode autonomy. Elderspeak affects residents' ability to make their own decisions and maintain control over their lives. Person-centered and relationship-focused communication is critically important in long-term care. Staff must understand that residents desire companionship and friendship, which brings a sense of well-being to their daily lives. Social contact and support from others have positive effects on the physical and mental health of residents, especially as some medical conditions can cause difficulties with communication. Communication styles that avoid Elderspeak have countless benefits and result in a win-win situation for residents and staff alike. Person-centered communication enhances understanding of residents' needs, traumas, concerns, puts them at ease, and makes them feel valued. It increases the staff's ability to provide the kind of care and support that they want to provide. When residents have friendly interpersonal relationships with staff, they respond better to care, experience enhanced quality of life, and are happier. How we communicate has far-reaching implications for the social, psychological, and job-related well-being of staff members as well. Person-centered communication promotes and enhances positive attitudes and relationships between residents and staff. It also improves job satisfaction for staff and enhances their feelings of meaningful and purposeful engagement. Understanding and addressing Elderspeak, along with experiencing positive results, encourages staff to continue working to achieve more effective communication with residents. How can you address Elderspeak in your organization?